Today we'll be speaking about the most neglected aspect of most of our lives, sleep. On an average, an individual spends anywhere between 6 to 9 hours on the bed, and yet it becomes the least spoken about or the most neglected aspect of his life or her life. Sleep, good quality of sleep, sleep-related issues, sleep-related problems not only affect the individual, but also has an impact on his quality of life, his work life, his personal space, and directly and indirectly impacts his family. With that concept, we at Bombay Hospital decided to help patients with all sleep-related disorders under one roof collectively.
I always used to have patients who came with sleep disorders and they were always confused as to which specialist to go to, which clinic to go to. I think our clinic solves that problem because we have chest physician, ENT surgeon, we have a psychiatrist and we have a neurologist on the team, and the patient can actually explain all the sleep issues with all of us under one roof together at one time, and this helps the patient as well as us to actually reach the right diagnosis and offer the right plan of management.
So before we started the sleep clinic under one roof in Bombay Hospital, we used to see sleep disorder patients individually and then refer to each other, and it used to take not just a lot of time but a lot of strain on the resources to be able to manage the sleep disorders of a patient. Now with a single sleep disorder clinic in which there are 4 specialists managing the patient, we can discuss among each other right there in real time and solve different problems that the patient might be having.
I think it's been very helpful not only in terms of looking at the mental health aspects of it, but also sort of learning new things in terms of working with this entire team. And that's been very helpful in terms of improving my work in general, as well as also in terms of being able to provide all these comprehensive services under one roof. And as we sort of worked on a lot of patients, we realized that when there were a lot of investigations that we needed to do as a part of the sleep clinic, so we have also created comprehensive and subsidized packages for the same.
The reason for the 4 of us coming together was I would be managing sleep apnea, Rajiv sir would be managing surgical corrections, upper airway obstructions, Vibhor sir would be seeing the neurological aspect of sleep, and Milan would be managing insomnia and other psychiatry-related sleep disorders. But when we started working with each other, we realized that a patient had more than one issue. A sleep apnea patient also sometimes had insomnia, required surgical correction, or was not comfortable with the CPAP. The neurological patients required dedicated sleep study or required psychiatric and ENT opinion as well. So a patient had more than one issue, and a problem could not be solved by a single specialist, which is why patients with complex sleep-related issues, or not just involving a single subspecialty such as sleep apnea, upper airway obstruction, insomnia, or a neurological sleep apnea such as central sleep apnea, our aim was to help them and aid them collectively in the best and the easiest possible way. So the 4 of us together as a team run the sleep clinic at Bombay Hospital every Thursday between 3 and 5 p.m. on the 2nd floor at the MRC building. Contact details for the follow are 022 2405 11162. So if you know anyone or you suffer from any sleep related disorder, please feel free to reach out to us so that we can offer you the best possible help.